Good morning, everyone. Before I start my presentation on express testing, I'd like to tell you a little bit more about the setting where we are offering the service. The Davy Health Center is the first of 5 health centers which HIM is operating in the Lower Mainland. We're right in the middle of the Davy Village. We're open 6 days a week, and we offer services from nurse practitioner, several physicians that are prescribing PrEP, nurses from Vancouver Coastal Health for testing, volunteer counselors, and coaches for our mental health program. We see somewhere between 40 to 70 people per day divided over all the different healthcare providers that work in the health center, and we have a total of about 7,000 test people per year. Why express testing? In 2017, more and more people were looking to access PrEP through the Davy Buyers Club. That's an initiative that described pathways for people to access PrEP by ordering it abroad and importing it yourself. In 2018, when PrEP was introduced through the provincial program with the BC Centre for Excellence, we were dealing with a significant increase in the number of clients that were looking to access PrEP. Physicians from the STOP team were working with those people out of the Davy Health Center, as many family physicians were not willing or unfamiliar with the process. Besides that, nurses were dealing with more and more complex cases like syphilis, which showed a significant rise in the number of cases in the last several years. People were facing very long waiting times, sometimes up to 6 weeks, to get an appointment for testing. And if people were doing a walk-in in the Davy Health Center, they were facing long waiting times, which could fit anywhere between 30 minutes to up to 4 or 5 hours. Because of the limited capacity, and people were absolutely not happy with that. To take pressure off the nurses so they could deal with the more complex cases and to offer a faster pathway for routine testers, Vancouver Coastal Health came up with the plan to start express testing. What is express testing? It's routine HIV and STI testing, including all the swabs and urine samples, done without interference of a nurse, but done by a phlebotomist. The phlebotomist is taking the blood work and the throat swab, and the client is doing the rest of the swabs and the urine sample himself. Express testing is currently only offered at the Davy Health Center and by appointment only. People cannot simply walk in and ask for express testing because people have to qualify. These are the qualifications. People are not supposed to have, next one. People are not supposed to have any symptoms, not to have any concern about a possible exposure that might require post-exposure prophylaxis or PrEP. You don't have any questions to discuss with the nurse. No, that's the next. That's the. That's this one. Oh, that's this one. Sorry. Yeah. Okay. You don't have any questions to discuss with the nurse, like starting with PrEP or discuss vaccinations. And you have to be tested at the Davy Health Center, HIM on the Drive, or at the Beauty Clinic within the last 12 months. The process. There's 2 ways to get access to express testing. Both pathways are using the same questions people need to answer. The first option is to go to our website, checkthemout.ca, and book your appointment. When you select the Davy Street location, you need to answer following questions first. If you answer all the questions with no, then you automatically are redirected to the express testing page, and you can book your appointment right away. If you answer one or more of the questions with yes, you're offered an appointment with a nurse. But those appointments are in general booked like 5 to 6 weeks in advance. If you don't want to wait that long, you can still do a walk-in. Other options is to come to the Davy Health Center, where you need to fill out a form with personal information, and that form has the same questions. The same here, all questions answered with no, then you can get express testing if there is a time slot available at that day and time. If there's no time slot available, then you're redirected to see a nurse. The process. So when you qualify and answer all the questions with no, then you are directed to the phlebotomist, who will ask a few questions to check if you qualify, and will collect the blood samples and the throat swab. He will hand over the materials for the rest of the swabs and for the urine kit, and which are self-collected. He will also let you know when and how to get the results. You're in and out within 15 minutes. But the phlebotomist is not able to do the rapid HIV test, which gives you the result in a minute, and he's also not able to answer questions you might have about risk or transmission or any other questions you might have. Express testing is not for you. So if you have any symptoms, questions, and/or concerns about a possible infection that might require immediate action, like starting with post-exposure prophylaxis, or if you might need treatment for an STI, you won't qualify. The same when your last visit was longer than 12 months ago, or when this is your first visit. We started with a soft launch with offering express testing on the bookings page of our website, and we did some more promotion at the Pride events in the Lower Mainland at the HIM booth. We offered the service 5 days a week, and we started with only a limited amount of time slots per day. It slowly started to take off, and now we're offering 7 to 10 time slots per day, which are mostly fully booked every day that we offer the service, and we also noticed that people only book like a few days or a week in advance. We also noticed that express testing works well for those clients who have a certain understanding of risk and symptoms, as they are better aware of what to pay attention to, or for those people who do regular testing for just to be sure. We increased the capacity for testing by offering a different service for routine testers who don't want to wait that long for an appointment, who are not willing to wait by doing a walk-in. Nurses have more time for more complex cases they are dealing with, and last but not least, we're slowly seeing an increase in repeat testers who have used the service before and who are anecdotally satisfied with the service. Thank you.